One conversation before surgery can prevent weeks of confusion afterwards. Here are the questions that every caregiver should ask. Welcome to From the Hip. I'm Tiffany Anderson, the health educator who became the patient. After multiple surgeries and years of recovery, I've learned that there is life after joint replacement. Each week, we'll answer one question that I wish someone had answered for me. In last week's episode, we talked about wellness strategies that patients can invest in as they prepare for surgery. And today, we're focusing on caregiver responsibilities. Your surgeon has prepared your loved one for surgery, but has anyone prepared you? So before you bring your loved one home from the hospital, let's talk about those questions that caregivers should ask. Have a notebook handy, maybe a cup of something warm and comforting, as we talk about 3 caregiving responsibilities. Here's question number 1. How will we manage pain safely? This is a question you'll discuss in depth with the healthcare providers and with your loved one. Hopefully they're not the only one going to the medical appointments, and as the caregiver that you're able to attend those appointments with them. You'll want to talk about things like the medication schedule afterwards to make sure everything is on track, as well as opioid safety. This is where you might want to consider having something like a lockbox or even a bag of some kind or a full cabinet that can be locked for safety. And this is for any number of reasons: safety for others, safety for yourself, and peace of mind. Along with the medication, another side effect to be considering, and as the caregiver you'll want to help your loved one with this symptom, is constipation. This is one that can be managed with additional medication, with stool softeners, and of course fiber in the food that they're eating. And as the caregiver, are you going to be the one preparing the meals or ensuring that your loved one is eating on a regular basis in order to help their body adjust after the procedure? With all of the medication, there's any number of symptoms that come into play. Talk to your doctor about that so that you as the caregiver understand what your loved one needs help with. Another aspect of the medications to understand is how to help your loved one transition off of those prescription medications, because some of the pain medications after surgery won't be needed after a time, and when to know how to transition and transition safely. Now let's move on to question number 2. As the caregiver, ask the surgeon, ask the healthcare providers, how can you help the recovery without doing too much? This is all about boundaries and expectations as well, because as caregivers, it's natural that we want to step in and do as much as we can, though we don't want to overstep our bounds and get in the way of our loved one's recovery. Now remember, your role as the caregiver, it isn't to do everything for them. Your job is to help them recover safely. So again, you're going to be wanting to talk about expectations and boundaries, and talk about that with the healthcare provider and of course the person who's going to be undergoing surgery. Ask them about their expectations, their fears, their hopes, and you as well. Talk about your own expectations. This can set up a conversation long before things can get uncomfortable. You'll also want to talk to the physical therapist, understand the instructions. Movement is often part of the day of surgery, if not the day afterwards, because movement expedites healing. And that can be a bit overwhelming because you're going to see your loved one in pain. They aren't going to be feeling great, though they need to move, and being able to see them in that pain and also encourage them at the same time can be a bit overwhelming. Know that. Be prepared for that and talk about it openly. As part of the recovery and knowing that Patients need a lot of rest afterwards and there's going to be a lot of swelling. Have ice bags ready. As you think about the inflammation, really understand the level of inflammation that you might be encountering and have room in the freezer. Have a variety of bags, a variety of sizes available, because it might surprise you depending on the procedure and the discomfort that your loved one's feeling, because it might be a very different type of discomfort. It might be headaches, it might be nausea. There's any number of reasons why an ice pack can be useful, and you'll be talking to the physical therapist and the doctors about those reasons. Smaller ones are great for those smaller areas, just something that's a little easier to tuck in around bandages. Having something a little more narrow that could be across the base of the skull or the shoulders, and of course those larger bags. There's even rice pack type bags. This one is a U shape that I often drape across my shoulders, though it also fits across my low back, and this one can actually wrap around the leg and up the side of the hip. So knowing what fits best, what's comfortable, and also the cautions, because where there's the inflammation, that's also the incision area. So it's going to be very tender, very painful, and very sore. If your freezer's small at home, you can always have extras off to the side, and then as you're applying the fresh ice bag, get the other ones in the freezer as soon as possible. There's also the chemical type that you can actually give a tap, and then the chemicals actually create an ice pack, and there's no refrigeration needed for ice packs like that. And as we're talking about the ice packs, then of course you'll want to talk to the doctor and ask them to help better understand what the swelling is going to look like and how soon you could expect the swelling to go down. Many procedures now are outpatient. When I had hip replacement, I was in the hospital for 3 days. Many people receiving joint replacement now go home the day of surgery. This varies from patient to patient. So with the swelling, knowing what you can expect as you go home, and then what to watch for as your loved one is healing and on their way to recovery, it will help you better understand that if there's any warning signs or anything that you should be concerned about. Another part of the caregiver role, and something for you to better understand, is the walking schedule. With joint replacement, it's important to walk, and there is an amount of movement that's expected every day to actually help to reduce the swelling and to expedite the healing. Talk with the physical therapist. Perhaps if you've got a rehab center that's going to be helping you, understand what to expect, and also any hazards or any concerns to make sure your loved one is safe. Falls are something you want to avoid, and something that can easily be prevented, because sometimes they're just everyday hazards at home. Think about rugs, cords, pieces of furniture that might be in the way. Those things can be taken care of well in advance. And then as your loved one returns home, whether they're on a walker or using crutches or transitioning to a cane later on, know how those devices work. And if a hallway is a bit narrow, what might need to be moved, and just better understand the focus of balance and how your loved one can improve their balance as they're healing and feeling more stable as they're walking and improving their gait. You know, there's falls prevention classes that are offered through organizations like the Arthritis Foundation and also local senior centers. And finally, to question number 3. This is an important one. Ask the medical providers about the warning signs that shouldn't be ignored. And just a disclaimer and a reminder, I am a health educator, I'm a patient advocate, and I'm a wellness coach. I am not a clinician. Any of the warning signs, know when you need to call a medical provider, even 911, knowing signs of an infection, understanding wound care. If you're going to be the one helping to change the bandages and watch the wounds, know what infection looks like and when to be concerned. Is there a bad odor, any fever? Know the signs of blood clots, and of course shortness of breath. Those are all signs that there may be an emergency, and of course you're going to seek medical attention. And here's one last bonus question. Who is the backup caregiver? You will want to know that. Your loved one wants to know that. And the healthcare provider should also know that, because they're going to be part of the process in all of the follow-up appointments. Have a backup, because sometimes you'll need a rest, you'll need a break, and it's always nice to have other people available that you can call on, whether it's friends, family, a neighbor. Have a backup caregiver. One question that I referenced in last week's episode is that as I was preparing for my own joint replacement surgery, the caregivers who I thought were going to be available for me, they were overwhelmed and underprepared. That's why I'm encouraging you to have these conversations and asking these questions now, because it can save you time. It's an investment in your own well-being, as well as the well-being of your loved one who's undergoing the procedure, and it's going to expedite the entire healing process for everyone. Going into surgery is stressful for the patient and for the caregivers. Do everything you can to make this a smooth transition. I hope these suggestions were useful. If you have additional ideas, please leave them in the comments below. What question should we answer in the next episode of From the Hip? Leave it below. If you're preparing for surgery, recovering, or know someone who is, subscribe and join us next week. Thank you so much for watching.